An unusual way of working with people who are insulin resistant or pre-diabetic, and it's not about the interventions I use, which are evidence-based lifestyle changes that are also deeply grounded in medical traditions. It's about the conversation I have around the consequences of not taking action before it's too late. Before the panorama, I did some intensive training in stroke rehab. It was a lot of fun. And working with stroke survivors clinically has greatly informed this conversation, because if this is you, you're at a much higher risk of stroke later in life. Stroke is the 5th leading cause of death, but the worst part is that a lot of people who have strokes don't die from them. And you might think, oh, no worries, if I stroke out and go, it's just my time and that would be fine. But you don't get to make that choice. A lot of people who have strokes become severely permanently disabled. And in addition to the very real physical and emotional pain this puts you in as a patient, you are also very likely to become a severe burden on your family, because you may require 24/7 care for the rest of your life. And if you didn't already know this, your insurance is not likely to pay for that. So I know being confronted with this information can feel like shame, and I am trying to present it compassionately but directly, because it's easier to make changes in the ways we eat and sleep and exercise when we have direct symptoms that can be tied to those changes we need to make, because they take effort. And the symptoms in this cluster are often very easy to ignore until they are not. But making a lifestyle change in your 30s or 40s before you have symptoms is going to have the greatest impact. We can see degenerative changes in your 40s, and it's quite clear that diabetes accelerates this. And if you can set aside for just a moment the incredible resilience that you have to tolerate your own pain, I would ask you to weigh the discomfort you anticipate from changing your habits against the pain your family will feel when they have to bathe you, dress you, and feed you for a decade or more.